Assalamualaikum and good evening. Today we are going to record our first Lex video. So my name is Nora Atika. My metric number is 177818.
And my name is Rafiza Roslan. My metric number 178865.
Hi, my name is Afika Shaira. My metric number is 177007.
Hello, my name is Aaron Michael. Matrix number 176349.
Hi, my name is Susian, matrix number 179123.
Hi, my name is Cheng Man and my matrix number is 180488.
Hi, I'm Troy Pang and my metric number is 179212.
Good evening. My name is Nuruzulaika binti Norizal. Metric number 179013.
Hi, I'm Teku Shaiza Izzati. My metric number is 177162.
Okay, my name is Hana Ai. My metric number is 179070.
Okay, so we just introduce ourselves, and actually we are just got back from a trip from Lenggong, and during in Lenggong we are split into two cases each. There are two cases. One case is for 7 groups and the other 7 groups got one case. So basically we have two cases that involve leptospirosis and Nipah virus. So today we are going to discuss first about the Nipah virus. So do any of you guys know what caused the Nipah virus? I'm not sure. Apika, do you know what virus caused Nipah virus?
Nipah virus is caused by RNA virus, right?
Yes.
So what is RNA virus?
What is the name of the virus?
I mean, what is RNA virus?
So the name of the virus is a paramyxovirus, right?
Yes.
It's paramyxovirus. From the genus of Nipah virus. Okay, just briefly about Nipah virus first, I think, before we go into the triggers and in-depth discussion. Okay, Nipah virus is an infectious disease, and there is an outbreak of Nipah in Malaysia in 1998. Do you guys know about it? No?
I don't think so because
We were
we
too
are not
young.
born yet.
We were born.
So, okay, so the disease, it will affect respiratory and nervous it will affect respiratory and nervous system. The reservoir is actually fruit bat. Okay, Intan would you like to give some explanations? The triggers?
The case is about Mr. Kasim. He's a 33 years old, the farm worker, and with primary complex of high fever, body aches, and sore throat for 2 days. So he was prescribed medication, but his condition did not improve. So 3 days later, he developed severe confusion and was admitted to the hospital, where he became drowsy and disoriented. His condition worsened and died 4 days after admission.
Mr. Kasim died.
Yes.
So sad.
Yes. And
What?
so,
Yeah, no, it's okay, continue. Later.
the attending physician they noticed that other patients also developed the same clinical sign. So they are interview the patient and they conduct the tracing by visiting the homes, workplaces, and the places that frequently visited by the patients. So what are you?
So, based on the two triggers that we just intelligence talked about, so what can you guys do you guys have any idea what is all about the case?
From what I heard is basically Mr. Encik Kasim, he fell sick and he had like several different clinical signs, but there are a lot of things that we don't know actually. One thing in particular that I would like to know about is what was he working as? I mean that really interests me. I mean because he doesn't seem like a normal, how do you say this? He didn't develop normal fever or or cold or something like that. Like the symptoms that he had were very 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 different. So first thing that I would like to know is what job was he working as? Were you informed in the trigger or anything?
Yes, he's actually a gear farmer.
Oh.
So the primary complaint is that he has body ache, high fever, sore throat. So after he's been given 3 days medication, he doesn't have any improvement, and then it will only get worsen. And then he was admitted to hospital with convulsion, drowsy, and disoriented condition. So and then after that he died after 4 days after that. So from here we can get the idea. So it is an infection. It is subacute infection because Mr. Kasim managed to show symptoms before dying, and then the 3 days medication without improvement indicates that it could be antibiotic resistant, and then with severe confusion and disoriented condition, we can conclude that he has the brain of him has been impacted, and then it could be seasonal disease, either enemy or because of the weather. So from here, what can we do is we should take blood sample or tissue sample. The tissue sample that we can get is the CSF. And then since he died, we can do postmortem to the carcass, and then we can also investigate the patient's history status from the family members, colleagues or neighbors. The diagnosis that we can do is the isolation and identification of either the virus or bacteria. And then for the trigger to since that it is found that in the hospital they have a similar case like Mr. Kasim. So and then there's information about bacterial culture and anti-sensitivity test is insignificant, means that it is not a bacterial infection. So it could be a viral infection or zoonotic disease, because the other patients that have the similar symptoms like Mr. Kasim is also the workers from the farm. And then
Sorry, I have a question. Like you mentioned, the reservoir is fruit bats, and he's a deer farmer. How is the relationship between them?
actually in trigger tree, we know that actually in the farm, they Mr. Kasim and his colleagues have been handling. There's a increase in visitation of fruit bats and wild boars to the farm, and then the sudden death of the wild boars. So Mr. Kasim
what I read lah, maybe we can. I mean, the virus can be spread through cut, but then it's not common.
Oh, okay.
And then there's actually one thing about PPE, which is proper equipment when handling. So you should have that if you want to handle the purpose. And
Do you want to add something?
Okay, actually, for your question, the virus is present not only in the bat's urine, but also in the feces, saliva, and also burping fluid. So actually, if the bat eat the fruits there, and the urine might spread to others' fruit, or if the bat they eat like only half of the fruits, then others' fruit they just left it on the ground, so the pig can actually ingest that. That's how they can also be infected.
Does it mean that the deers could be infected as well?
Yes, there is also possible of direct contact when the deer eat the fruits. That's how.
So
it
in this particular case, were there any transmissions of the virus from either the bats or pigs to the deers, or did the workers only got the disease?
Actually, the deers
yes, from the triggers that we receive, any
the deers are showing signs of convulsion. Okay, so no.
yes, because from what my group have been discussed is it is meant bats to pigs and pigs to human, or from the bats to human.
This one, my discussion with our
But
facilitator.
from what Dr. Lokman told us, maybe the from human to human we can also get infected, but and also from the pig or from the bat, the other animals can be affected, but it's still unknown, and no one has been discovered by it.
So indirectly saying the pigs have a higher chance of susceptibility to the spread.
I think it's enough of Nipah virus. Why don't we go to another case?
Okay, well, since most of us here actually discussed about that, I mean, most of us had a case about leptospirosis, so I think it will be easier. Just a brief description about the case. Basically, for the case in leptospirosis, what we got was there was a worker called Ali, 45-year-old man. He worked in this farm where suddenly he fell sick. Alright? And in that similar time, there were 8 students that came to do practicals in that farm. And out of 8 students, 6 of them got ill as well. So they showed signs of fever, cough, abdominal pains. However, the worker actually had more severe symptoms. So he had erythematous rashes, conjunctivitis, and yellowing of the eyes. So other than that, other important things that we can get from this case is that during the duration when the students were there, when they had their practicals, the place received a lot of heavy rainfall. So it was raining quite a lot during that time, so they had to clean a lot of the puddles and the waters and all that. And other than that, at the end of their practical session, the 8 students as well as Encik Ali, they went to the river to have a barbecue session and just play around. So those are some of the important or notable facts from this case. So
Anything you guys want to know about the case of leptospirosis?
What is the transmission of this virus? I mean, this disease.
And how did you guys figure it out that it is leptospirosis?
Okay, so the first question is the method of transmission. So basically, it is usually transmitted through rat urine. So when you have contact with urine, especially when there is wounds,
spiral shape indicates that it's a leptospiral. And also, besides that, we can conclude that the disease is leptospiral because Aaron mentioned just now six of the students like went to the waterfall for some activities. So they could be rat urine inside the water and they get infected. And we also took some water sample from the river, and the results of the water sample and also the rat kidney is like the same.
In addition to Simon's point, the transmission actually not only through the skin, because we know that in PTH Lenggong, their source of water is from the river. So it could be, the daily usage of the water from the river, and when they got it, they even though they might not be having a good filtering system, and they always use that water for drinking and for daily routine, so they got it like through ingestion. Yeah.
Yeah, and I would like to add some point about the route of transmission. So firstly, we might suspect that rats might be the reservoir for the leptospirosis, but as we may know, leptospirosis is actually a dormant bacteria which they exist on the soil itself. So in the trigger, it has mentioned that the farm actually had heavy rainfall, right? So then in cases, right, the bacteria from the soil actually during the heavy rainfall, they get washed down to the river, and then thus they contaminated the water source for the farm, and also a lot of them may get infected that way also.
And then according to that, because this virus actually they have their own incubation period or latent period. So basically, even though Mr. Ali he had been working there for 20 years, but maybe he got it earlier, and how to say, and then the outbreak still haven't happened yet because this bacteria usually this virus they usually stay in the body for a certain period until when stress comes, for example during a heavy downpour, and then the virus will just flare up. But then for another student, they even though they work for 2 weeks there, but then they still got it because it's according to different incubation period and also the stress factor that allow the environment.
And also immunity level.
So different people have different kind of clinical signs and even have different time taken to show the signs.
So what can we do to control this? So basically, if this case happens, so the department will notify the hospital and also the farm itself, and then the department the hospital will alert for the impending high infections of these cases, and the department will basically will try to control the rat population in the farm, and also they will have take water sample from the river and do the water analysis, and then they will also do some awareness campaign to notify the neighboring area for not to use the river water.
Other than that, actually, you can just do simple things like, because basically, like what Simon said just now, the transmission of this virus, this bacteria is actually through the urine of the rat. So normally you get rats in a farm because of your the feed storage is not proper. So you have a lot of rats, they stay in the feed storage. So I think simple things like just cleaning up the store or just ensuring that there's no overpopulation of rats can also make a very big difference.
Yeah, and waste management is also very important, like to eradicate not really eradicate, like just reduce control the population of rats. So we have to keep our farm, keep the cleanliness very good so that there won't be rats coming.
Other than that, we also have to have the farm usually has to have proper fencing, because even though rats can be bringing lepto, but then they could be transmitted to another animal, and then when the animal contact with these two, Mr. Ali and the other students, they also get infected also. So it's good to just have a proper fencing for the animal in the farm and then outside the farm, so that they won't come in and bring other diseases.
May I know
I mean, I don't think we have vaccination for leptospirosis because there's no need for it. Leptospirosis is a bacteria and it can be treated with antibiotics. So there's no need for you to vaccinate because you have a medicine for it in a way. And if you fall sick, like in our case, Encik Ali and all the 6 students that fell ill all survived. They all recovered. So there's nothing tragic here.
As long as they seek for medical treatment as early as possible, then it is curable and no problem.
And also to add, because leptospirosis has a lot of different serobars, so it is quite difficult to make a vaccination.
So usually they will give a wide spectrum antibiotic so that it can treat all the serobars. And there is this question in my group that I find very interesting. During our discussion, one of my group mates asked that why don't we use like poison or anything to kill all the rats, or maybe like insert poison into the water so that the rats will be killed. So what do you guys think?
No.
I think that we shouldn't kill all the rats because once we kill the other rats from outside can still come in, right? This is a ecosystem, so the rats will still come in. So what we can do is to reduce, like to control the rat population, not to kill them.
A proper garbage system, not to throw rubbish away. And like what he said, proper facilities for the feed storage.
And another control that we can do is, since this disease already spread in the PTH, right? So the river is already contaminated. So we should like temporarily close down the river to avoid other villages from contacting with the river.
Or set up a board like there's a risk of leptospirosis in this location, so be aware and then
I think that's all for 2 cases today.
hope that you learn a lot from us.
Basically, in short, the first case was about Nipah virus, whereby it resulted in the death of Encik Kasim. Yeah, because it's a viral disease and it's an acute infection. So for the second case, it's a leptospirosis case, which there were like seven people involved, and all of them recovered. I think that's all from us for now. Alright, thank you.
Thank you.
Berapa?